And finally, one of the great young leaders of the healthcare reform movement on our side, a gentleman who's probably done more to carry this issue forward recently than any of us. I'm pleased to have Dr. Burgess with us. Doctor.
Thank you, John. Any ideas about that young stuff? Because as Trent was talking about the telephones, I remember the year I went into practice in a rural part of Denton County, I was on a party line, and I used to have to ask people if they'd mind vacating the line so I could call in whatever for my patient. I really like this bill. I like the sensibility of this bill. I like the emphasis that it puts on where really the rubber meets the road in healthcare, and that's where the patient and doctor interact in the treatment room or the operating room, the emergency room, what have you. You think about how our government has punished through the tax code someone who has the audacity to own their own insurance policy, someone who wants to have a longitudinal relationship with their insurance outside of their place of employment. And yes, they can do it, but it's going to cost them significantly more than it does for someone who purchases insurance through their workplace. I like the way that this bill puts the responsibility, really gives the dollars to the patient and allows them to direct where the healthcare expenditures go. And if nothing that we have looked at in any of the other proposals, and I don't want to talk about the other side stuff because this is John's moment, but nothing in that huge proposal that's coming out this afternoon really does anything to limit volume of health purchases, except for perhaps putting some caps on physical therapy and radiology. But otherwise, we don't address the volume side at all. Well, we can address, and we will have to address the volume side one day by rationing. We've created a system that's too big to fail, if you will, with this government-run system that we're doing. If you give that purchasing power to the individual, I know from personal experiences as a physician and as a patient, as a family member, a patient's family member, you make much wiser decisions about how those healthcare dollars are spent. In 1996 or 1997, I wanted to be one of the first ones on my block to own the new medical savings accounts as they came out. You may remember when those were first introduced, we were only going to have 750,000 of them that were allowed, and I was so fearful that I would arrive just in time to see the last one snapped up before I could get there. Well, I needn't have worried because I think only 30,000 of them were purchased, but it was an excellent idea, not just because I got to put money away in a medical IRA, if you will, but the fact that not someone at the end of a telephone line at 1-800-California, but I was able to decide where I went for my care, when I went for my care. I directed those dollars, and it puts a lot of power in the hands of the healthcare purchaser or the patient, if you will. But thank you, John, for doing this. I think it's a great step forward, and look forward to working with you to get it passed.